I'm really happy to be here, and I was delighted to hear the first two talks, because what I'm going to present on ties in really nicely with the things that both Susan and Liz spoke about. I'm really passionate about the work I do. It was really hard for me to contain the information to 20 minutes. So please know that this is really just an overview. I am happy to answer questions at the end. But this is a fairly brief introduction. No conflicts of interest or financial disclosures to report. So this is what I hope to cover. Why psychology? And I think, I think both speakers this morning have already kind of given me a sense of why that piece might be important. And then what are the goals of psychological treatment, and what are some of the key evidence-based practices that are helpful for managing migraine, and then the importance of addressing other mental health conditions that may precede or come after living with migraine. So, consistent really with what Liz was talking about, migraine is a biopsychosocial phenomenon. It is not just like the broken computer. It is not simply something that we can fix with necessarily. A lot of medical interventions, medications do amazing things with migraine pain. But for many people, particularly when caught in a persistent or chronic migraine cycle, that is not the whole picture. And so we exist in a social environmental context, and it's really important to pay attention to those influences. And with psychology, it's really about focusing on the internal experience, on your thoughts, your behaviors, how do you respond to emotions, physical sensations, and work with them. So that I was writing some things down that Liz was talking about in terms of raising the tolerance of the brain and decreasing the trigger load, but also increasing coping. And for many people who have lived with migraine for a long time, there can be a lot of a sense of loss or grief associated with how it's disrupted one's life. There can be other mental health conditions. I know Susan spoke about having panic and her mood being affected and so on. So there's many effects, and underlying mental health conditions can certainly help to perpetuate the chronicity of migraine. So that's my quick why psychology and how it sort of fits in. All these pieces are linked. So the goals of psychological treatment are ultimately to decrease suffering and improve quality of life, and to enhance confidence in your ability to manage migraines in an ongoing way, and ultimately decrease reactivity to the pain experience and gain a greater sense of control. For many people, this does ultimately lead to a decrease in frequency and intensity of headaches. And for a lot of people, I get quite a few people are referred to me by their physician because the medical interventions don't seem to be having an impact. So they come and we work together for a while, and then people will sometimes say, you know what, the meds are working now. Or finally, I'm noticing that I'm not getting as many headaches, or they're not knocking me sideways as much. So those are some of the goals of psychological treatment. Getting into some of the models. So cognitive behavioral therapy has been one of the most studied psychological models with many conditions, with migraine and chronic pain being one of those conditions. And I'm going to give you just a really brief overview of the elements of this model. And please appreciate that this is not in depth. So the colored circles there are, they represent our internal experience. And certainly we are influenced by our environment. And our autonomic nervous system, our nervous system is always trying to perceive whether there's a threat, whether it needs to go into protective mode. Its job is to protect us. And so there may be, you hear on the radio, a Chinook or a weather change is coming in. There may be amping up in terms of your work demands, or you might notice some of the early signs. You might have aura, or you might notice other early signs that often precede migraine for you. And so what happens is we often get into thought patterns. Oh, here we go. I'm going to get another migraine. It's going to be a disaster. I'm going to have to call in sick for work. And go down a path in our thinking really that puts some migraine in control, not us. We have all kinds of emotions that get activated. We might just instantly feel really irritable or sad or discouraged. And as Liz talked about, there is an interaction between the brain and the rest of our body, and we do have all kinds of physiological symptoms. And so sometimes those are panic type symptoms. Sometimes we notice we're starting to amp up in our stress response, and suddenly our pain shoots up. So all kinds of things. And so paying attention to what is arising in your physical sensations is a key part of managing migraine, and also noting what are behaviors. So sometimes we get into patterns of behavior that may have worked initially, but they're kind of keeping us stuck at this point. So, I know Susan spoke about, she got to the point where she was anticipating future attacks with cat-like readiness. I wrote that down because this is what happens when the autonomic nervous system gets activated. And so this can happen for a lot of people with migraine is we just kind of attend to what might trigger it. So, I know weather change is coming and this woman just walked by me with really strong perfume, I'm doomed. And we get into thoughts and so on, and then we engage in other kinds of behaviors. Some of those behaviors may be escape avoidance behaviors. We may just opt out and say, it's a write-off. I'm just going to opt out. I'm going to cancel everything. Sometimes we might do things that help us feel a sense of control in the moment, like I'm just going to go like crazy and get everything done because I probably will be out for the next few days, and so on. And we get in these patterns in an attempt to get a greater sense of control. But sometimes it doesn't work for us. So really looking at what are some of your patterns can be helpful. And then just briefly, so cognitive behavioral therapy, the C part, the cognition or thinking part, it's important to ask yourself, what are you saying to yourself in response to potential triggers, about your ability to cope with the pain, about the impact that migraines are having or will have on your life down the road, and about the pain itself. Are you saying, this pain is killing me, or it has to be, I can't have any pain, it has to be, I have to be completely pain-free, or I can't function in my life. The cognitive skills then in response to managing potentially some unhelpful thinking is, so mindfulness was briefly addressed previously. Mindfulness is key, and I will talk about mindfulness in its own right. It doesn't belong to CBT, but it's a really important part of CBT because it's about observing our inner experiences, including our thinking. And one of the key tools for cognitive tools in cognitive behavioral therapy is a thought record, in terms of looking at patterns of thinking that may not be that helpful for us, may not be quite accurate in terms of our current experience, and maybe need a bit of updating so we can come up with some more balanced thinking that doesn't cause us such distress. So, one of the questions is that line of thinking helpful? And if not, it might be helpful to look at it. One of the patterns of thinking that a lot of us get into is catastrophizing, in terms of going to worst case scenario. There's lots of research on patterns of thinking, catastrophizing, that is linked to worse outcomes in chronic pain and in headache. And so I can't really say more about it just due to time, but the reason we have this label for it is because of so many of us do it. So this is not something unique to people with migraine. This is unique to humans. Again, when our nervous system's activated, we orient to the negative. We're looking for danger, and catastrophizing is a pattern that comes of that. So the B part of CBT, there's lots of behavioral strategies that are really helpful for managing migraine. Self-monitoring in terms of what might be those threat versus safety messages coming into our nervous system. How might it affect our physical sensations and those pieces that might play a role in activation or perpetuation of migraines. Behavioral activation, if you're sort of so shut down and have been kind of out for the count for a long period of time, maybe off work and so on, and it's hard to kind of get moving again, some behavioral activation strategies can be helpful. Pacing is really an energy management kind of approach. Exposure to uncomfortable feelings, sensations, and I will speak a bit more about this with both acceptance and commitment therapy and mindfulness, but we need to move toward and expose ourselves to difficult feelings and sensations in order to regain some sense of control. So pain is such an aversive experience. We all often want to check out. We want to move toward escape avoidance. And in the long term, that is not a helpful pattern. So one of the strategies in treatment often is moving toward and getting to know your pain experience. And then problem solving and relaxation, I will speak more about shortly. So acceptance and commitment therapy is a cognitive behavioral therapy as well. It's a bit more of a more recent cognitive behavioral therapy that approaches some of the cognitive and behavioral, I guess, patterns that aren't working for us in a little bit of a different way. This is really a rather simple description of it, but essentially it's about our sense of control is in the present moment. So we bring ourselves into the present moment, move toward and observe and accept uncomfortable experiences that allows us to free up energy and orient toward what really matters to us, to live consistently with our values. Essentially, it's about letting go of the struggle. So we often get into a struggle with our pain experience. So that big red monster there is migraine, and that's the person at the other end is someone who's living with migraine and fighting with the migraine and trying to either push it away or regain control. And that struggle creates a lot of tension in the body and the mind. And so the idea with ACT, or acceptance and commitment therapy, is to drop the rope, let go of the struggle, acknowledge that the monster is there, and you can bring yourself into the present and regain control. So when we get into a fight with our experience, it's like it's here and we push it away and we're fighting with it and it's coloring everything. When we can drop the struggle, let go of the rope, we can move it to the side and we can work on shrinking it. You know, a migraine still may be a part of your experience from time to time in an ongoing way, but it doesn't color everything anymore. So mindfulness, a key part of both CBT and ACT, but also a skill and a helpful tool in its own right. And essentially, it's about focusing our attention, bringing our attention to the present moment to observe our experiences with acceptance, with curiosity, and without judgment, with self-compassion. And observing our experiences, that curiosity piece is critical. Observing our experience as if for the first time, without fighting with it. So think of that tug-of-war rope, and just allowing it to be. And when we can take our attention, what we can begin to notice is pain's variable nature, and we can start to get a bit of distance from our reactivity to it, which releases our associated distress. So the ultimate goal is to move from reacting to responding. So in letting go, it actually puts us back in control. I just wanted to go over some myths about mindfulness. Many people have heard about mindfulness or practice mindfulness. It's really, it's kind of big out there, and I'm sure you've seen it on social media and the news and so on. And, I've had a number of clients come to me and say, I can't do it. My mind's too busy. I can't get to an empty mind. And it's actually not about getting to an empty mind. It's about observing your experience, observing where your mind goes, and then gently bringing it back to focus. And many people say, I can't do that when I'm in pain or I have a migraine. And certainly that would be a hard place to start your mindfulness practice. But with some practice, you can actually practice mindfulness in the midst of fairly intense pain. So it does take some practice, but most people start to notice shifts relatively quickly with regular practice. The other myth is that it should always be pleasant and relaxing. I should feel warm and fuzzy whenever I sit down to meditate. And that is not necessarily the case, because when you pause and tune into your experience, sometimes you might tune into something that you've been avoiding and not attending to. There may be some sadness, or there may be some physical sensations. And so noticing those and not getting hooked into evaluation of them, but noticing them can be part of the experience. So most people do find that it is a calming kind of experience, but in the process, there can be some connection with pain. The other piece is that, I know when I was trying to get my teenage sons to practice mindfulness with me, there was some, jokes about we don't have the crystals or the incense or the mystical music. And certainly some people do practice in that way, and you're welcome to, but it is not necessary. So mindfulness can be brought into everyday life, into everyday activities, going for a walk and tuning into your senses and noticing what's going on for you and so on. So there's a variety of different ways in which to practice mindfulness. There's a lot of studies showing the helpfulness of mindfulness for chronic pain and migraine. I wanted to include this study just because it's really recent, March 2021, so it's hot off the press. And it was a study comparing mindfulness-based stress reduction, MBSR, which is Liz made reference to in terms of the program developed by Jon Kabat-Zinn. And they compared it to headache education. Both decreased frequency of migraine, but the mindfulness intervention also decreased sense of disability or impairment in one's life due to the migraine, decreased pain catastrophizing, which I spoke about in terms of a thinking pattern, improved mood and quality of life, and a sense of self-efficacy or ability to manage in response to migraine. I'm probably running out of time. So just briefly, I want to speak to relaxation and grounding strategies. So the intent of mindfulness is different than the intent of relaxation. The intent of mindfulness is to bring your attention and get out of reactivity to your internal experiences. The intent of relaxation is to activate that relaxation response in the autonomic nervous system, to bring us down a notch, to slow the heart rate, slow and deepen breathing, and so on. The calmer you are, the fewer pain signals generated by the emotion center in the brain, the less activated that nervous system is. And so the brain doesn't pump out as many pain messages. So relaxation and mindfulness fit really nicely together, but the intent of the practices are different. And so just being aware of that and practicing both can have a huge impact. And then some grounding strategies, and there's lots and lots of these, but I just wanted to speak to it, kind of combines a mindfulness and relaxation. And when you're feeling overwhelmed with the pain, overwhelmed with really intense emotion, having some grounding strategies to kind of help you settle and come back into the present be very helpful. When you're overwhelmed, it's pretty hard to just sit and meditate. So I've just listed some of the relaxation exercises that have been most studied. I don't have time to go through all of them, But there is evidence for all of these kinds of relaxation strategies in terms of helping with managing migraine. I will be guiding you through a brief autogenic relaxation shortly. And I just want to encourage you to please stay with it and be patient with the process. So psychological interventions are, it's not like taking a pill and sort of instantaneous relief, but it doesn't take a long time either. So for most people, it does not require long-term therapy. You can start to notice differences. I'll often meet with somebody and meet them a week later, and they're already starting to notice a change just from practicing daily. It is really important to also pay attention to and address other mental health conditions that may be present. They can certainly have an impact on migraine, and migraine can also have an impact on mental health, as Susan mentioned. So there is a correlation with anxiety, depression, and migraine, and it seems to be bidirectional. They each affect the other. There is a higher rate of migraine in people with PTSD. Important to address addictions. If you're caught in an addictive pattern, it can perpetuate a migraine, a chronic migraine. And sometimes that addiction is to medications that have been prescribed to you. And there can be a lot of frustration related to that. And it's helpful to speak about and address that, but then make a decision, because staying caught in that can just keep you kind of stuck. And other mental health conditions, and certainly sleep problems, huge. So a lot of people have difficulty with sleep related to their head pain and say, well, once my migraine's better, I'll start to sleep. And I have had success with using cognitive behavioral therapy for insomnia with people, even in the midst of a chronic migraine cycle. And that has been it doesn't solve the migraine problem like that, but it certainly plays a role. It's a piece of the puzzle, and you can address these conditions at the same time as addressing migraine. Going forward, I just want to offer you hope. There are lots and lots of things that we know are helpful for managing migraine. And I certainly, in my clinical experience, have seen a lot of people make significant headway in improving the quality of their lives. So thank you. Any questions?
Awesome. Thank you so much, Janice. Really an excellent presentation. I love the breakdown of cognitive behavioral therapy. And especially when mixing it with mindfulness, some excellent questions coming in on mindfulness. One of those first ones is there a useful workbook to help the processes of tracking and reflection that can help with pacing?
That can help with pacing?
Pacing, yes.
That is a very good question. Like an online app or something like that. I'm sure there is. I'm sorry, off the top of my head, I don't know. I have some old paper versions and so on that I've used. Let me think about that.
It's all good. We'll get back to that. Any tips for accessing mindfulness during really dark moments of symptoms?
Tips. Well, I would start with doing a relaxation exercise first. It's really hard to direct your attention in a mindful way when you're in the midst of reacting to intense pain. So if there's something you can do to kind of settle down your body and nervous system a little bit, it allows to free up that thinking part of your brain. Some people find it helpful to actually take their attention to the pain experience and observe it by noticing changes in shape, texture, heaviness, and so on, and begin to observe their pain. So it gets them out of reacting to, this is horrible, this is awful, I have to escape this, but to paying attention and noticing that there are moment-to-moment shifts in that experience. And I'm not saying this is easy. In the midst of intense pain, sometimes avoidance is what works. in the long term, it's not the most helpful strategy, but sometimes taking a strong medication and going to bed is what you need to do. So it's not meant to minimize that experience.
Absolutely. A true biopsychosocial and sometimes spiritual approach. Understanding how important medications are. Certainly when I'm working with patients, I think those dark moments are difficult. I mean, this isn't always the right time, but I find the teaching, and you mentioned this so nicely, is about when the triggers and the auras start to kick in. And really, that is the time to use a lot of the skills that we're talking about to make sure we don't allow our emotions and our thoughts to get out of control. But rather, that's the time to kind of sit and, okay, it doesn't necessarily mean it's going to be the worst migraine ever. I'm not going to jump into some of those deep thoughts. It doesn't mean it won't be, but it doesn't mean it will be either. And, certainly the anxiety around migraine, and as a migrainer, I'm well aware, and certainly growing up with a mom who suffered with migraines, we used to know when we got home and the blinds were closed and the door was closed and it was dark, you just kind of backed out of the front door and you stayed outside and played, and you just kind of knew that process. I guess the other questions then come in practicing mindfulness. You did a great job of dispelling this idea that mindfulness is about blanking your mind out and that your mind is too busy. If a mind's not busy, there's probably other problems going on. Mind is supposed to be busy. So, what kind of tips and suggestions do you make about learning and practicing mindfulness? What would be those first steps?
I think it's hard to just pick up a practice on your own and sit in silence and try to direct your attention. It does take some practice. So I find a lot of there's some really great mindfulness apps that can be helpful to start. Or I might suggest a mindfulness group, but it's COVID, and that may not be realistic. But starting with an app, there is one app I've found that is designed for people with persistent pain, called 𝐒𝐿, which I think has some great mindfulness recordings. And there's many other ones. But I guess be kind to yourself. Observe the key things. Observe your experiences with acceptance, with curiosity, and without judgment, with self-compassion.
Love it. I think one of the most difficult processes in most healthcare systems is they're designed for acute issues, heart attack, stroke, broken leg. Our system is incredible at treating those processes, but chronic complex illness, this idea that it's up to us to go learn our own issues, and we have to use an app, we have to read a book. It's unfortunate that is the way it is. And any healthcare providers out there, I often tell primary care physicians and other healthcare providers, get good at teaching people mindfulness or CBT, and I also get this pushback. Well, I'm not a psychologist or psychiatrist. Well, I don't think that matters. You don't have to be a psychologist or a psychiatrist to be good at mindfulness, or to catch your thoughts, or to teach people about CBT or mindfulness or acceptance or any of these processes. I often apologize for our system, and I'll do it again. I'm sorry for all of those that have to go learn it yourself. And for those healthcare providers watching and listening, go get good at one thing and help people learn, even if it's one thing. And there's so many retreats. Well, I guess with COVID, there will be retreats again coming, and going for a weekend retreat to learn about it so you can teach people who would really benefit from it is so important. Again, thank you, Janice. I've really had the privilege of getting to know Janice over the years, and we've worked in 2 different programs, from the addiction world and the pain world, and really have always been in awe in what you do. So thank you for joining us, and we'll see Janice again coming up. And once again, I'll pass it over to Christelle.